Today marks 1 year since World Health Organization announced COVID-19 as a pandemic. Since then, we have lost more than 500,000 Americans. The world has lost more than 2.6 million people. How do you look at this 1 year? What's the biggest thing that you learned while you were on the front line dealing with these patients?
Oh boy, the biggest thing that I learned was about the health. Health is number one. No matter what you say, no matter what's going on, no matter what your aspirations are in life or what you care about, health is number one, as we can see. It's enough to be able to shut the whole world down if health is not prioritized. So, that's why they have that phrase, well, at least you have your health. So if everything else is gone, what else do you have at the end of the day? And so I think it's a great reminder for everyone to prioritize their health, their wellness, to ensure that they are putting their own body and their own mind first.
Right.
Because only then can you actually do anything else in life.
Right. Dr. Bahl, how are the conditions in the hospital right now? We keep on hearing cases are going down. The death rate is also going down. Do you also see that?
Yes, very much so. Things are substantially better. At the time we spoke about a year ago, we were one of the hospitals that was very at the center of this whole pandemic, and we had all the trailers that you were seeing with the bodies and all of that, and the entire hospital was filled with COVID patients. It's not like that at all right now. We still have patients who have COVID here in the hospital, a number of them, but it is so much better than it was at that point. And everything's manageable. We don't need the tent that we had in front of the hospital where people were, first getting seen in the tent, then coming in to get into the hospital for other issues. We don't even have that tent anymore. With regard to me and the procedures that I do, we're still keeping safeguards in place. So if you're going to have an elective procedure with me, meaning not an emergency, and you're going to be coming from home for that procedure and going home the same day, you have to have a COVID test within 5 days, a negative COVID test within 5 days of coming in for our procedure. So we still got precautions in place. Right. Checking temperature, wearing a mask always, getting that test. Other than that, things are pretty manageable now.
And what about the status of PPEs? How are you doing on this? Has there been any issue with the supply of those?
No, not at all now, because we just don't have the volume that we had before. Like, as I mentioned the last time, it was 2 of our ICUs were filled with COVID patients. So because that's not the issue, we don't have that severe need for it right now.
What are you predicting in the next few months with COVID-19?
That's a tough one. Really, it's a matter of how many people are willing to get the vaccine. What is the vaccine rollout? I know President Biden was hoping that by May, everyone who wants one should have a vaccine at that point. So we're looking at, it's March 11th now. So we're looking at maybe about a month and a half, 2 months, where really everyone should be vaccinated should they want to be, whether it's any one of the 3 vaccines.
Right, for sure. Let's now dig into what I have you here to talk about today, the mental health crisis that is facing the nation, as well as the stress that is facing everyone. My first question to you on that has to be, what, according to you, has been the impact on the mental health of people in this country due to COVID-19? What have you seen throughout the year as a doctor when people are struggling with these issues?
So as an interventional radiologist, I don't deal with mental health from a medical standpoint, like head on. What I can say as someone who has been meditating for over 20 years and observing the world around me, social media has already been one major thing that's just been a major decline in people's mental health. Then you add on top of it a global pandemic, and you add those 2 together where people are basically stuck at home. They're not able to interact with people, and humans are inherently social beings. So not having that human touch or that human interaction has made people feel very isolated. It's brought on a lot more depression. Then you add on the fact that they're, of course, using a lot more social media, so they're watching lives outside of themselves, in certain instances, in places where people are a little more active and kind of living their life. And then you really feel like you're having a lot of FOMO, you're having fear of missing out. And that's something where I think, and I personally know people who have said that they have unfortunately declined in a lot of ways in terms of just how they felt. They said, I just feel so alone and I've got no one to communicate with. And I'm just watching this digital world. All the meetings are on Zoom. I think in another world, I would love to be able to be sitting in the studio with you right now and having a real conversation. That's something that we would be able to do, but we're just not seeing that right now. Everyone's very isolated.
Right. And what do you think is the impact on people who have already had mental illness? Do you think that's been even worse for them?
Yeah, because now you don't have whatever outlets you had before. Even if you had, let's say, and just I'm going to name a couple of them: bipolar disorder, schizophrenia, whatever it may be, or depression. Uh, all of these things are manageable, yes, with medication, sure, but the human element, the human touch, the ability to just interact with someone and explain your problems or share the problems and even listen to someone else's, that's completely lost. And I think the digital world can only do so much, but really you need that human to human interaction. And I think that they at a baseline already are struggling with it in their own respect. And now you're adding something else on top of it.
Right. So, when we are talking about a lot of anxiety in the nation, a lot of depression in the nation, I want to go to coping mechanisms, because that is exactly what the public needs right now to get through this pandemic. You have a very unique approach to how to handle stress, and as well as how to handle the mental health issues somebody could be having. So let's talk about depression, anxiety, and panic. It's one of the most common mental health issues we have found so far in the last year. They say 4 in 10 adults are facing with depression and anxiety right now. How do you look at it, and how do you bring your own techniques into making it better for people that have these conditions?
Yeah, so to first answer your first question, how do I look at it? Well, there's a lot of different causes for these things that we say basically come from the mind, come from the brain. There are neurochemical pathways. What that basically means is, there are certain hormonal levels or neurotransmitters. Basically what that means is the way brain cells talk to each other that can be off in terms of the amount of level that you need. Sometimes they're too high in certain people, sometimes they're too low. And again, I'm not a psychologist nor a psychiatrist, but I've been working with the brain long enough from some of the research I did on meditation around maybe 11 years ago, down at Emory University. And, we looked at certain stress hormones and inflammatory levels in people with regard to how they handled things like meditation. And we got to see some of the positive effects there. So we do know that there is a neurochemical and hormonal imbalance that can be happening in people who have depression and other situations. And then some of those things may be circumstantial. Some of them may be with their own genetic makeup. Some of these things can be passed from generation to generation. So you've got a number of things to deal with here. You've got your family, you've got your environment, and how basically you've got your own coping mechanisms. So there are multiple approaches to this. Sometimes it's cognitive behavioral therapy, for example, where you meet with a psychologist or therapist and you talk about what's going on with you, and they have a whole bag of means to help people cope with their particular challenges in life. Then you might meet a psychiatrist who can give you medications and also help with you and have these discussions with you, and they're very effective, both of those means. Then there's a lot of things that you can do on your own, and now this kind of brings it to me, where you were asking about how I manage it. Well, as I mentioned, I've been meditating for about 23 years or so now, since I was in high school, and it's been a daily part of my life. It's been something I've been using not only for coping mechanisms, but something that I've been doing to actually thrive, not just to survive situations and say, how do I manage this particularly stressful situation, but how do I even prevent the stress in the first place? How can I control my reactions to things before they even happen? And that's something that I've found especially useful doing meditation for quite a number of years. And it's very well studied. There's a lot of research on it, a huge body of research that's been growing substantially year to year. If you do year-to-year comparisons, the amount of meditation research out there has been substantially growing. And I've seen the benefits in myself, especially being someone, as you and I were sharing over text message the other day, about how I manage complications at 3 a.m. if I'm doing an emergency operation at someone and things are not going well, and there's and just to be very frank, forgive my candidacy here, but they can be bleeding to death in front of me. How do I manage that? What do I do? And I've been able to keep myself calm and keep the room calm. And that's been done with a lot of my meditation techniques. Not to say that's the only way to do it. Of course, people got their natural coping mechanism, but for me, it's very, very helpful.
Dr. Bahl, I would love to know, just a basic question, a follow-up question on meditation. What is it doing to the body that it calms it down? What is exactly happening, scientifically or not, to the body, which creates that little, center of a person where they can think and perhaps have less stress?
Sure. So you just asked me something. You said where they can think. So the idea of meditation is to actually let go, is to not think so much. You're trying to still your mind, actually. You may, before you sit down to meditate, you may actually ponder on the things that were facing you, from the day or in life, and that's wonderful. You do want to reflect on those things. But the ultimate thing is, after you've done that, take the time to sit down and actually be aware of your breath, consciously aware of your breath. Now, how does that actually work from a biochemical standpoint? So what you're doing is, as you stop moving, you still your mind, and you don't think about what happened, what's going to happen in your life. You're just here in the present moment. When you start doing that, your breath starts to slow down. Your heart rate starts to slow down. And that's just because you're detaching yourself from all of the other happenings going on in your life. So you become a passive observer of all those things rather than trying to be actively involved in it. And as you sit there and passively observe it all, as your heart rate slows down and your breathing slows down, you're just watching it all happen. And so what that does is it creates a lower amount of stress hormones, cortisol being one of them, which we actually studied in that study that I was a part of a number of years ago. The inflammatory markers actually start to decrease, so stress and inflammation start to go down. And the more you do it, the pleasurable neurotransmitters in the brain actually start to increase. So for example, dopamine, which is a pleasure-giving neurotransmitter, that actually starts to increase. You smile more, you feel more happy. And I would say where does all of this come from is because you are detaching yourself from the past and the future and from external perceptions of yourself. A lot of our stress comes from Log kya kahenge, right? What do people think about me? What are they going to say about me? What will they say? What did I do? What will I do? But imagine a life where you're just in the here and now, not looking at your phone, not thinking about work or your family or your friends. You don't have to do this long. This isn't going to be a couple of hours a day. This is literally even 1 minute of mindfulness. I always suggest 5 minutes a day, which we all have 5 minutes a day, but sometimes you only got one. And if you can be mindful in that moment, you really start to see these substantial benefits. And then the last thing I'll mention, they've actually done brain scans on this. There's a type of MRI of the brain called an fMRI, and the fMRI studies they've looked at actually have shown that in people who meditate regularly and for longer periods of time have reduced blood flow in the fear centers of the brain. And people who don't really meditate or don't have any of those coping mechanisms actually have more blood flow to those fear centers of the brain, meaning their brain gets overly active and overly heightened based on the stimulations that they see.
Right. When you are looking at meditation, and this was a really good insight into it, of how it really calms down the body, how do you use meditation now to then handle grief and trauma? That's another two issues that we have seen across the nation. With the loss of life, there's a lot of grieving. Trauma experiences have been there for the families, doctors, and so on and so forth. How have you used that?
Personally, for me, I keep a regular daily meditation practice. But fortunately, in my hospital, I've been asked a number of times to help some of the other physicians at my level, meaning no longer in training, as well as trainees, residents and fellows who are going through training and have dealt with these patients on a day-to-day basis in the ICUs at the peak of the pandemic, and I had given some instructions on meditation, because in order to heal other people, you have to make sure you're healed. You have to make sure you're mentally and physically as strong as possible. So I think we all need it. And we were facing the hospital as a whole, a lot of the residents and fellows and other doctors who were definitely in the ICU, in the emergency room, they were facing a lot of grief. They were seeing a lot of death in front of themselves. And I was dealing with the complications of those. We were all trying to find coping mechanisms for ourselves and with patients. And again, that brings me back to meditation. That's what I was teaching them at the time. And it's something I've been doing for myself. And look, I don't care who you are. I don't care how advanced you are. As long as you still have desire, still have the attachment to this body and mind, you're still going to feel some degrees of grief and loss whenever something, negative happens. That's a natural response to it. But what you're learning to do is you're learning to cope with those things better, because they're inevitable. Grief and trauma are inevitable in life. Right. So what you're trying to do is manage your expectations with those, manage how much you respond to it. And that's an important concept. I'm not always in control of my circumstances, but I'm in control of my response to them. And that's where meditation comes in. You learn to be more detached from those situations. Not that you care any less, but you're just more detached. You understood that I did everything I could for that particular person or that particular situation. Moment to moment, I did everything I could, but the results are out of my hands. And once you learn that, you're a lot more calm about it, and you're able to move on to the next thing.
Right. I have 2 more questions left here for you, Dr. Bahl. I would love for you to give us a small demonstration of meditation, anything that somebody could be doing while sitting. What do you suggest? We would love to get some tips from you.
Sure. So one of the basic premises of mindfulness meditation, which I think is a really wonderful way to start, is to pick a quiet place. And what you're going to do is you're going to sit with your spine erect in a chair. So, your back as straight as possible, and your palms, just like this, your palms facing upward, and just relaxed on your thighs. And your chin is going to be parallel to the ground, so it's basically looking straight ahead. And your eyes are going to be slightly lifted to the point between the eyebrows. And that is the what we call the third eye in Hinduism in particular. But actually, you'll notice that concept in a number of faiths. And you slightly lift your attention to that point between the eyebrows, and you're going to close your eyes. And all you do is you just be aware of your breath as it goes in, as it goes out. You don't try to control the rate of the breathing. You don't try to even control your thoughts. You allow them to come and you allow them to go. And the idea is that you're basically watching the breath and not being bothered by all of the mental distractions that are going on. And each time your mind wanders, don't even think about it. Just bring your attention back to the breath. And then very shortly thereafter, your mind will wander. It's okay. Just bring your attention back to the breath. And so, and by doing that, you will start noticing that your heart rate and your breathing start to slow down. And even just a matter of moments of doing that, not even 5 minutes, just even 1 minute, you'll start to see that benefit. And that's the basics of mindfulness meditation.
Right. It's truly regulating the body, as I can understand from you. It was so great having you with us on ITV Gold. I would love for you to give one last message on this topic to people, perhaps to people that are struggling right now and do not know where to start from.
I would say that if when you want to begin a meditation practice, one of the really good things you can get in the mindset of is, I don't have to be perfect at it. I don't have to have an hour a day to be able to do that. Any time is better than nothing, and any effort is better than nothing. So don't use your schedule as a hindrance. Don't try to be perfect at it. Just regularly sit where you are, follow that basic premise of the technique that I was talking about, and just start doing the practice. And the more and more you do it, just like anything else. I can describe how cake tastes, but you're never going to know until you actually taste it. It's the same thing as meditation. It's all based on experience. And that's where you can get started. As you do it more and more, you may be prompted to start, to looking for organizations and other means to do it, which are all over the internet. Of course, you're going to find a whole range of things. One really effective place I think is wonderful is Headspace. It's an app you can get on your phone, and they've even released it on Netflix too, which I think is really wonderful. It's a really wonderful place to start.